Universal mandated reporting, guidelines, and penalties to prevent child maltreatment. Have you ever had a child come to you and tell you that their mom or dad hits them so hard it leaves a bruise? I've had one of my children's friends come to me and tell me that his dad punches him in the stomach when he gets mad at him. I asked him if he'd like me to report him to Child Protective Services, but he told me no because his mom was a teacher and his dad was well known in the community, so nobody would believe him and it would just make things worse for him. So I didn't. I still regret that decision to this day and think I should have done something to better protect that child. I've asked many people I know what they would have done in a similar situation. Most of them have said that they would not get involved because they don't know what to do and they don't want to put the child into more harm or think the child's better off with their parents than a foster home. Examples and opinions like this are part of a problem as to why child maltreatment is underreported in our country. Most adults agree that child maltreatment is a serious issue, yet preventable, and someone should take action if abuse is suspected. Yet many people don't know what to do, how to report it, or are fearful of repercussions of reporting for themselves or the child. Inaction could be for various reasons, but regardless of the explanation, it's an injustice for the children. The national organization Prevent Child Abuse America conducted a national norm survey with 1,000 adult participants for child abuse and neglect, asking questions about perceived and actual norms regarding child abuse and neglect. 65% of the individuals polled stated that they are less knowledgeable or comfortable with taking action to prevent child maltreatment for fear of it making it worse for the child. An average of 35% of respondents had a fear of personal safety or concern over retaliation by the perpetrator or didn't know what to say or to do. Federal guidelines to help protect children from maltreatment were enacted in 1974 by the Federal Child Abuse Prevention Act, known as CAPTA. States hold the primary responsibility for child welfare services and have enacted their own laws. States that accept CAPTA funding must meet minimum federal standards, but each state has its own definitions of maltreatment with civil and criminal statutes. Part of the problem that I find with states having their own statutes is the discrepancies found amongst the states, leaving room for error in what is to be reported and to whom it should be reported to. State laws are also variable in who is considered a mandated reporter and whose duty it is to report to the authorities. There are also lax civil and criminal penalties for not reporting, most states being just a misdemeanor, which can also be a factor in the cause of underreporting. So, who is responsible for protecting our children? We all have an ethical obligation to report child abuse, and it should be a legal obligation as well. Individuals designated as mandatory reporters typically have frequent contact with children. Professionals most commonly mandated to report across the states are social workers, school personnel, healthcare workers, mental health professionals, child care providers, medical examiners or coroners, and law enforcement officers. Only 12 states also require commercial film and photograph processors. 6 states require computer technicians, and only 14 states require substance abuse counselors. 13 states require directors of employees and volunteers at entities that provide organized activities for children, such as camps, day camps, youth centers, and recreation centers, where many children spend a majority of their time during the summer.